Welcome to the photo tutorial of iSCOPY. We are going to show you different ways an oral cancer can present, and sometimes it is confusing to even the trained eye and trained personnel. So our aim is to familiarize with you with different pictures so that whenever you are looking into the oral cavity, you can match the lesion with one of those photos, and when you take a picture, you know how to take a picture, where to take a picture, and a picture, when transmitted, will give good information to the people who are going to help you with diagnosis. Now, the first picture that we are seeing here is an ulcerated lesion, typically what is called in the textbook a cauliflower-like lesion. This is a typical lesion of tongue which can't be anything else than oral cancer. Because most people in India, they use tobacco in the form of pan and khaini, and they keep it in the cheek pouch for a very long time, and sometimes they leave it there for a very long time, and sometimes they sleep, and this leads to a typical cancer called gingivobuccal sulcus cancer, which you see here. And this is not an infection. Don't treat it with antibiotics. It requires treatment, and that is surgery. Similarly, if you have a cauliflower-like growth in the upper palate, this is typical appearance of a palatal cancer. Sometimes you have white patch, red patch mixed in the gingivobuccal sulcus when you retract. This is a cancer which coexists with leukoplakia or a white patch. Here you see an infiltrative lesion, an ulcerated lesion, which is one of the forms of oral cancer. Again, a cauliflower-like growth in the soft palate, a typical soft palate or oropharyngeal cancer. Here is a picture where recurrence has happened after previous surgery in the remaining bone, and you can see a whitish abnormal looking area which cannot be ignored. Sometimes cancer can be multiple. In this picture you see there are 3 different sites and multiple white patches in the lateral border of tongue, and each one of them is individually diagnosed to be cancer. Here again you see that there are 2 cancers, one in the lip and one on the right cheek, and if you see carefully, in between the mucosa is normal. Here you see a large growth which is sitting on the tongue, and usually these are carcinosarcomas, and this patient has a very large growth like thing, but it is pedunculated with a very small stalk connected to the tongue. Again, this is a very uncommon cancer, but you may see sometime. Here you see that entire buccal mucosa, commissure, lip is covered with a white plaque-like thing, and verrucous carcinoma may present like this. These are typical keratosis, which is in the smokers. It's a pre-malignant condition. On the right commissure you see a white patch. On the left side you see that there is an ulcerated malignant transformation. This is cancer in a patient who had submucous fibrosis, and you can see that the right retromolar trigone, there is a bleeding ulcer, and the biopsy, if it is taken, is positive. This is a leukoplakia which is covering the entire half of the tongue. This happens usually in tobacco users. There is no other diagnosis than leukoplakia, and if you use a gauze piece, try to rub it away, it doesn't go away, that proves that it is a leukoplakia. Erythroplakia, a red patch. Whenever there is a red patch, you should be very cautious, because these patients, they have very high malignant transformation rate, and they cannot be ignored, and something has to be done. A large white patch, again a leukoplakia. A small white patch, again a leukoplakia, a pre-malignant condition. Small multiple whitish patches, these are all leukoplakias, can't be diagnosed as something else. Here again you see a whitish patch, a leukoplakia. This is a leukoplakia. And large lesion like this, very growth like thing, and this is a verrucous leukoplakia which has got a high malignant transformation rate. Multiple white patches, take a gauze piece, everything gets rubbed off. This is not a leukoplakia, this is a candidiasis, and this is seen in immunocompromised people. This patient has a sharp teeth, chronic injury. You see that there are no everted edges, there are no cauliflower like growth, but there is a ulceration which is having a um, necrotic slough covered there, and it is a traumatic ulcer or a dental ulcer. This is the linea alba, which is because of the teeth. Chronic injury is happening in the buccal mucosa that leads to linea alba, which is not a pre-malignant condition. This is grade 4 mucositis, which is seen in patients undergoing radiotherapy. After 15 days or 20 days, usually it settles on its own.